Welcome to The Big Unlock, where we discuss data, analytics, and emerging technologies in healthcare. Here's some of the most innovative thinkers in healthcare information technology talk about the digital transformation of healthcare and how they are driving change in their organizations.
Hello again, and welcome back to my podcast. It is my great privilege and honor to have as my special guest today Dr. Toby Cosgrove, the former president and chief executive officer of the Cleveland Clinic. Dr. Cosgrove was CEO of the clinic from 2004 to 2017 and currently serves as an executive advisor to the clinic. He's also an executive advisor to Google Cloud's healthcare and life sciences team. Dr. Cosgrove, welcome to the podcast.
Well, it's a pleasure to be here. Thank you for inviting me.
Let me start with a broad question, Dr. Cosgrove. What are the top 2 to 3 issues today for American medicine as you see it today, and what is the role of technology in addressing them?
Well, there's no question that healthcare is driving increasingly to value, and we must get value from our healthcare, and that means keeping costs under control. That also means improving the quality of the care. In parallel with that is accessibility. We can't provide great health care unless we have accessible health care. And I think that technology is going to be a major player in all of these things. We need to use that to begin to efficiently and more effectively deliver this health care. So I am very hopeful and optimistic about the role of technology for providing great health care.
The talk everywhere you go is about digital transformation of healthcare. And we know that telehealth in particular has made significant strides. Now, what does digital transformation mean in your view? And what is your assessment of the current state of digital transformation in healthcare? What do you think health systems need to be doing?
Well, clearly, the more as we move healthcare from a art to a science, that applies, says that we've got to put numbers to it. And more we are relying on the numbers and healthcare, and the numbers are piling up at an enormous rate. Think about, for example, the human genome, which is now becoming part of the clinical care. That's got 3 billion base pairs in each one of them, an enormous amount of data. Think about the number of journals that are being put out. There are 5,300 medical journals putting out over 800,000 articles a year. That's a tremendous amount of data. They look at a mammogram that has as much information as the New York phone book used to have in that. So we are accumulating a tremendous amount of data. It gives us the ability to bring science to healthcare, and it then provides both a problem for us, managing it all, and an opportunity that the opportunity begins to allow us to learn new things and predict things that we've never been able to do before.
Right, and the volume of medical knowledge is growing exponentially, and we'll come back to that in a couple of minutes. Dr. Cosgrove, you're now advisor to Google, and so now you have a view of the healthcare industry from the technology provider side of the equation. There's several emerging technologies that seem to have potential. We talk about cloud, talk about AI, AR, VR, the HoloLens type of technologies, voice enablement, blockchain, and so on. My firm has done some research that suggests that technology vendors don't necessarily think that healthcare is moving fast enough to leverage emerging tech. The same research also suggests that healthcare execs don't think emerging technology solutions are mature enough yet. What are your thoughts now that you have a view from both sides of the equation?
Well, I think both are true. For example, healthcare really moves very slowly, and I think it moves very slowly for a number of reasons. Obviously, when you have people's lives involved, that tends to have people be cautious about how they adopt new approaches. Similarly, healthcare has not gone out and put a major emphasis on adopting new technologies simply because of the pay and for that is an inhibitor in many cases. So healthcare has moved very slowly. In fact, one of the disturbing factors and pieces of data is that if you look at when something is proven to be a beneficial new technology, between the time that's proven and the time that it becomes standard of care is 13 years.
Right.
So healthcare moves very slowly. Second thing is that technology is not been generally as applicable to healthcare. And I think part of the reason is that it's easy to look at healthcare from the outside and not understanding the problems associated with it for technology companies. And so I encourage technology companies to begin to get deeply involved in healthcare so they understand the intricacies of it and the odd things that we have to deal with.
Right. Now, staying on that for a second, you mentioned the technology provider ecosystem and the need to collaborate and integrate more closely with healthcare enterprises. If you look at the digital health startup ecosystem, it's been receiving a ton of venture capital money. Last year, I read somewhere it was about $8 billion in 2018 for digital health startups. Now, we also know that many digital health startups are struggling. At the clinic, you have your own innovation group that has incubated successful startups, and you yourself contributed to several innovations during your career, and you hold several patents. What is the state of the digital health startup ecosystem today? What advice do you have for startups that are struggling in particular?
Well, I think I alluded to this earlier, that I think you need to understand and address a problem which is currently recognized by healthcare institutions and integrate yourself and begin to solve those problems in collaboration. I think the idea that there's going to be a major disruption in healthcare is difficult to imagine. Healthcare is the biggest industry in the United States right now. And to think that any sort of startup is going to disrupt it is, I think, a little naive. Hopefully these startups will help us solve problems that are currently existing, and I think that will be a road to successful implementation.
Speaking about the larger tech firms, then we've talked about digital health startups and their approach. Now you have an association with one of the largest tech firms out there, which is Google, and others in that same category, Microsoft and Apple and so on. They're also making significant investments in healthcare. Do you think that they have a better shot at it, or they have a better handle on how these things need to be managed in order to accelerate this technology curve for health systems?
Well, the large companies got tremendous opportunities because of the resources they have. They have tremendous intellectual capabilities and they have tremendous financial capabilities. And when you combine those two, they have the potential for being very helpful in changing and improving the efficiency of healthcare delivery and the quality of the care, I think is enormous. And I think properly applied, this is going to be a major help in dealing with the issues that I spoke about and driving towards value.
Right. I read a research report recently. It was published by one of the big consulting firms that says that technology adoption, the data shows that technology adoption in health systems is directly a function of the pace of the shift towards value-based care. In other words, those that are moving faster towards value-based care seem to embrace technology a lot more than those that are still mostly in a fee-for-service environment. Do you agree with that? And if so, what needs to happen to accelerate that shift?
Yeah, I do agree with that, and I agree with that for two reasons. First of all, I think organizations that are moving increasingly toward value are probably more flexible and more open to innovation, and that makes them more open to innovation, regardless whether it's moving to value or it's adopting new technology. The second thing is that I think that people now recognize that when you are moving to value, you have to seek out those efficiencies, and this technology is an opportunity to do that.
Well, let's talk about AI in healthcare. Now, AI has been all the rage and all the buzz in the last year or two, and clearly AI seem to have tremendous potential to improve healthcare. There's also a lot of hype around it in today's context. Some of the other issues seem to be some of the ethical questions being raised about, the use of personal data, and also the potential for bias in algorithms that can end up being discriminatory in practice. And we don't know that there's a lot of that happening in healthcare, but it has been seen in other sectors. When you look at AI, what do you think are the big opportunities in healthcare, and what do you think are the big issues that are going to be a challenge in accelerating adoption of AI in healthcare?
Well, I think we do not yet know the true efficiency of healthcare, but of AI in healthcare. But I think we do understand that the ability to take large numbers and find the predictive value and discover previously unrecognized associations is enormous. We have been doing this on a much smaller scale for 30 years, and the more we look at data, the more we understand, and the more we begin to be able to address previously unrecognized problems. Now, AI, I think, is an opportunity to begin to do that. And I've seen remarkable examples of that. And I'm sure that in time we will see more and more. The real question, I think, is the question about privacy and who owns the data. And that, I think, is something that we're going to have to work out over a period of time, who has the responsibility for it. I think increasingly citizens recognize that their data is not personal. People willingly now give up their financial data in a number of different ways. Is healthcare going to be looked at in a similar sort of a fashion, or is that going to be different? And I don't think we know yet.
Right. The big tech firms, notably Google, Microsoft, they've made tremendous investments in building these advanced analytical capabilities, AI capabilities. Google, for instance, has its DeepMind division, which reportedly has really advanced technology that can be applied in the context of healthcare. At the same time, health systems are heavily invested in electronic health record systems, Epic, Cerner, and so on. How do you see these emerging capabilities from these big tech systems that don't necessarily have a big footprint yet in healthcare? How do you see them integrating and playing with, let's say, your systems of record like EHR that are deeply entrenched and are an integral part of the hospital operations today?
Well, first of all, I think you made a very good point that the EMR are deeply entrenched, and I don't think that you're going to be able to replace those, particularly the major players, the Epics and the Cerners of the world, because healthcare systems have made a huge investment in those technologies. Now, the question is, how the tech firms play with these electronic records. I thought it was very interesting that the major tech firms came together and agreed last summer at the White House that they would, in fact, collaborate and share data between them with the permission of the owners of the data. And this, frankly, begins to bring interoperability, which is a major thing that healthcare has been looking for a long time, that we didn't get when the government funded so much of the electronic medical record purchase. So my hope is that as data is stored in the cloud, as probably going to be the most efficient way to do that in multiple clouds, then that gives us opportunity to have interoperability, which would be a tremendous bonus for looking after the U.S. population.
Right, and clearly there's been a lot of focus on the interoperability question over the last few years, and the CMS and the ONC, they've been championing open standards for a while, and they're trying to get all the players in the ecosystem, namely the technology firms, to open up and share data through common APIs and whatnot. Now, I think it clearly seems like there is progress being made, and we are going to see that come to a logical conclusion in terms of more open exchange of data among the technology providers. But the technology aside, I had a question about the current state of data exchange among the healthcare participants, such as, for instance, between payer and provider. What is your assessment of the state of data exchange between participants in the healthcare delivery ecosystem, and what needs to change for improving outcomes and for lowering costs of care?
Well, that's been one of the issues. We've not had that exchange that's gone back and forth between providers, but as we move increasingly towards value, and both parties, I think, recognize the importance of sharing that data back and forth, and we're seeing that happen increasingly. It remains to be seen how fast that will happen, but if you look at major corporations like Optum, for example, who's collected a huge amount of data, obviously well attached to United, that gives them an enormous advantage to understand how you move to providing value in healthcare. So I think as pay increasingly moves towards capitation or moves towards value, you're going to have to see that there will be increasing collaboration between those two entities.
Do you think in that same way, do you think the shared services programs, ACOs, those are the kinds of vehicles that are likely to facilitate this?
Yes, absolutely. I think that's where you expect to see it.
Right. Well, talking about EHR systems again, I read an interesting article in the Harvard Business Review just last week, I think, which quotes a study that the healthcare sector spends an extra $1 billion a day due to the additional documentation that clinicians spend time on. And there's some other data points as well. Since 2009, the number of words in an average patient note has doubled to about 700 words. And other developed countries are about a third of that, in third of the number of words for an average patient note. I mean, all of this kind of points to sort of a documentation burden on clinicians. And we know that since EHRs came into being, we've seen a lot of overwork on the physicians and incidences of burnout. Where do you see the industry 2 to 3 years from now in terms of addressing this challenge?
This is a huge problem right now across the United States. The burnout rate is about 50%, and one study showed that for every hour a doctor spends with face-to-face with a clinical problem, spends 2 hours in administrative work, and that is one of the major contributors, quite frankly, to burnout amongst physicians. There's a number of things that we hope that are going to begin to address this, but to me, one of the huge potentials is natural voice recognition. And when you can begin to get that to be a part of a physician's recording of data, I think that will begin to release some of the burden that is currently being placed on physicians in their examination. I would expect that that's going to happen first, not in primary care, but probably one of the places it will happen will be in the specialties, because in primary care you have more things that you have to sort out and less defined pieces of information that you need to record and ask about. So that's why I would think that it might happen first in the specialties.
Right. Now, switching back to emerging technologies and digital health and digital transformation, there's certainly a lot of excitement around the possibilities that these new technologies represent. The other side of the equation also is the costs. And so the broad question is the payments environment, is the current framework of reimbursements, is that conducive to the adoption of these emerging technologies? Where does it stand today? We know, for instance, telehealth, one of the challenges for adoption rate has been the lack of clarity around what the reimbursement rates are going to be, and all that is slowly emerging. But is that a factor, and what do you see needs to happen next?
Well, I think clearly in the adoption of telehealth, it has been a major factor. But do you stop and think about once you get capitation, then telehealth becomes a real impetus. There's a real impetus for telehealth to keep people out of the hospital, keep them out of the emergency room, keep them out of the doctor's offices, and that will be the financial spur that drives the adoption. And increasingly, we're going to see telehealth, I think, is going to blossom. Right now, Kaiser, for example, which is a good example of a capitated healthcare delivery system, sees more than 50% of their visits, only 50% of their visits in person, and the rest of it are done virtually in one way or another. So right. I think this is the future of where you're going to go, and I think as the payment changes, and right now Medicare, Medicaid has said that they're going to have 50% of payments related to some sort of risk sharing program by 2020. That means that we're on our road to that type of environment, and I think you're going to see a takeoff in these sorts of modalities for distance care.
Right. Kaiser's example of 50% of their visits as e-visits is widely quoted. It also points to another important factor, which is that at a corporate level, at an enterprise level, there's got to be some strategic goals or objective towards moving substantially towards a capitated model, towards virtualization of care, and so on. We know that there is a trend of care moving out of the hospitals into outpatient facilities and eventually into homes, which is where all of the emerging technologies sort of play in a big way. So, what are your thoughts on that trend? Is that a definite accelerating trend? And where are health systems by and large in that journey?
Yeah, healthcare systems, I think, are moving slowly in that direction. We're seeing more and more outpatient surgery as things become less and less invasive. We're seeing shorter and shorter hospital stays. The number of hospital beds in the United States over the last 30 years has dropped from 1 million to 800,000. And I expect that the majority of the communities are still overbedded. And so you're going to see the acuity of patients who are in the hospital go up, and more procedures are being done and as outpatient. Then on top of that, what we are seeing is less and less acute disease and more chronic disease. And chronic disease clearly is going to be looked after in the home and the physician's office as opposed to in the hospital.
Right. Well, Dr. Cosgrove, over the holidays, I had the pleasure of reading your book, The Cleveland Clinic Way, which I believe was published in 2014. In the book, you discuss everything. In fact, you kind of foresee a lot of the things that we're seeing today. And you discuss everything from the merits of group-based practice, EHR systems, technology innovation, and even the art collection at the clinic and its role in healing. So, question for you, if you were to write the book today, what would be different?
Well, I think that I would talk increasingly about the technologies that we've talked about and the potential for those technologies. Both talking about the digital, increasing emphasis on moving to digital, the increasing opportunity that provides for analysis, for understanding, and the technologies, particularly around telehealth, predictive precision medicine with genomics. I think all these are exciting opportunities. If you look at, if you stop and think right now, what is healthcare going to be like 5 years from now? There's going to be the care is going to be done in a different location, more outpatient. The people looking after you are going to be increasingly technicians and non-physicians or physicians extenders of one type or another. The diseases are going to be different in terms of more chronic disease and less acute disease. And the treatments are going to continue to get more sophisticated. So we are in a continuum of change, particularly now augmented by the technologies that are now emerging. And I think it's an incredibly exciting opportunity for healthcare.
Well, I have one final question for you in that vein. What is your advice to young people looking at healthcare as a career option? Now, I have a vested interest in that question. My daughter is a psychology major who works with autistic children, and I'm just curious to know what you think are the prospects for young people getting into healthcare today, and what should they be looking at?
Well, first of all, let me say that a lot of people say, well, I don't think health, it's a good profession now, and why would anybody go into it? And I think healthcare is a tremendous profession. It provides the tremendous satisfaction from being able to look after people, and you can always count on it making a honest living and being financially secure. It's not going to be some place that you go to become a member of the Billionaires Society in the United States, but it certainly will provide financial stability. So I am very optimistic about it. You see a lot more and more people being directed to that as you see the applications to medical school way exceed the number of slots that there are in medical schools in the United States. So there's no paucity of people who of high quality who want to enter the profession. So I think it's a great profession, and I think you have to be open to innovation, and that to me is a very, very fertile field for advancement. And if you are open to looking at new approaches, I think there'll be endless opportunities.
Thank you so much for that. Dr. Cosgrove, it has been such a pleasure speaking with you today. And once again, thank you so much for being on my podcast.
Oh, pleasure's been mine. Thank you for the opportunity.
Thank you, Dr. Cosgrove. Bye for now.
We hope you enjoyed this podcast. Subscribe to our podcast series at www.thebigunlock.com and write to us at info@thebigunlock.com.